Hello, I'm Dr. Brian Prax. I'm a chiropractor. I'm certified in functional neurology, and I'm also a registered Trigenics. The purpose of the talk today, or the little workshop today, is Trigenics for the knee. And in particular, we're going to talk about chronic knee pain. Trigenics has been and is very effective for acute knee injuries, so we can probably help you out with that. But the thrust of the talk today is on knee pain that someone's had for over 6 months long. In particular, Trigenics can be very helpful for bone-on-bone arthritis. People who tell me that they have a need to take, a lot of times, daily aspirin or ibuprofen, Tylenol, or some sort of pain-relieving medications. I've been able to help people where their doctors have said they need to have surgery for the knee. People will report back that they're having difficulty walking up or even downstairs, more common downstairs. Squatting is difficult, and just life in general, moving around is very difficult from this chronic knee pain. So if that's you or somebody you know, then Trigenics may be the solution for you. So let's talk about how it works. Trigenics does have an 85 to a 90% success rate. So that means there's a 15 to a 10% not success rate where we're certainly not able to help everybody. Some people just do need to have the surgery. Some people just need to learn how to live with the pain, and Trigenics is not going to help out. But essentially, what does Trigenics do? Well, as the name implies, tri has to do with three things. So there's three things that are combined that the Trigenics uses, and one of those is going to be a neuromuscular re-education or a neurological phenomenon that uses reflexes. So reflexes are part of that. We'll talk about that in just a second. There is a breathing component that comes along with that, and I like to describe it similar to what many women have learned in Lamaze classes from years ago, where you focus almost on a deep, almost a meditative sort of fashion, where you're focusing on your breathing. In doing so, it actually helps you to monitor your body, to really get a deep healing, and also to help modulate some of the pain that can be felt with some of the therapies that includes with Trigenics. And then the third component of Trigenics is where the patient is actually having an active component of moving certain muscles and joints as well. So let's talk about those reflexes. The first and most common one you may see at a sporting event. And if you can see the trainer right here and the athlete, this is called an autogenic inhibition reflex. And an autogenic inhibition reflex is when you see the trainer holding resistance, in this case of the athlete's leg. The athlete here is pushing quite a bit of force, contracting this muscle back here called the hamstrings against the resistance of the athletic trainer, or in our case the trigenist. By contracting this muscle against resistance, if you do that for 6 to 10 seconds and then suddenly stop and relax, the muscle automatically goes into a relaxation state, and you're able to get quite a bit more stretch out of that. It's an excellent way of stretching that. Well, the trigenist will apply one additional force, and he or she will activate those reflexive trigger points in the muscle itself, and it's almost like you really are increasing this inhibition reflex. It's kind of like the inhibition reflex on steroids, so it really gets a super relaxation of a very, very tightened muscle. And when we're talking about the knee, we're going to be talking about the hamstring. We may need to do some work on a little tiny muscle behind the knee called the popliteus. On the other side, right where his hand is there, we'll work on the patellar tendon. There's a lot of tension at the bottom part below the kneecap right here. And then since the patellar tendon is also connected up here to the quadriceps muscle, we'll also need to do some relaxation and some lengthening of the quadriceps muscles as well. So the autogenic inhibition reflex, by definition, is a sudden relaxation of muscle upon development of high tension, which is what we're seeing here. It's a self-induced, meaning the body will do itself, inhibitory, negative feedback, lengthening reaction, so we're lengthening the muscle by stretching it, and that actually protects against muscle tear. So it's a body's natural system of protecting against tear, and Trigenics utilizes that reflex. So the next reflex is called reciprocal inhibition. That's another reflex that the Trigenics will tap into, And that describes the process of muscles on one side of a joint relaxing to accommodate contraction on the other side of the joint. A really cool reflex. Naturally happens, and I'm just going to show you with my biceps here. So as I voluntarily contract my biceps, what will happen is reflexively on the opposite muscle, the antagonist muscle, the triceps in this case, will relax. So one way of getting a relaxation of the triceps is to tighten up the biceps. And so with this reciprocal inhibition, we can get a relaxation of this muscle by contracting this muscle. That reflex is also used in Trigenics with the trigenist applying pressure to the muscle that we're really trying to get the relaxation on. So we can take those tight muscles, again the quadriceps, the patellar tendon, the popliteus, and oftentimes the hamstrings, and we can get a super relaxation of that. Because what happens often with chronic knee pain and acute knee pain is you get damage to the joint. In a reflexive, protective mechanism, the body tightens up muscles to kind of hold everything together to prevent further injury. And what ends up happening is that it ends up locking down, and it becomes tight, so tight that this knee joint here is getting crammed down into each other. There's no more joint space in the protective mechanism, and it'll stay like that for years. The original pain from the injury, and even the original injury is long gone. It's 5, 10, 15, or sometimes 20 years ago, but now we've got this contracted musculature that's just jamming bone on bone. And if you leave that there long enough and you go walking around on it, sure, Tylenol, Motrin may relieve that, and even over time your pain may relieve, but sure enough, those bones are going to be wearing each other out, and then on x-ray you'll show bone on bone. Getting a knee replaced without fixing the cause of the problem, which is these muscles being so tight and shortened, is really only going to be a temporary solution. And that's why knee surgeries and the replaced knee only last so long, because the muscles are going to grind those right back down too. So reciprocal inhibition, I have a really cool little thing here that shows how it works. Let's see if we can make that a little bit bigger. Yeah. So reciprocal inhibition is like this. Little play here. As weight is added, in this case to the bicep, weight is added, the receptors inside the bicep is recognizing, oh, we're getting a weight on it, and then what ends up happening is that the muscle will naturally tighten up, and it will allow this to stretch down so it doesn't injure that. So that's the part of that stretch reflex. A little bit lower on that reciprocal inhibition, the coolest thing is when this muscle here is contracted, like putting a weight on it, then these muscles will relax so we don't have a tug of war going on, so to speak. So it kind of works like this. When the weight is applied, this muscle contracts, and at the same time, the tricep relaxes. So Trigenics is tapping into that. And again, the practitioner is applying the pressure while the patient is gently pulling his or her joint, in this case the knee joint, through a range of motion. So the pressure is applied at the trigger point through a range of motion, tapping into that reflex. And at the same time, there's a certain breath that sounds like this. Trigenist says go. The patient over 6 to 10 seconds is relaxing, focusing on the breath, and all three of these components are happening while we're making some permanent changes to the muscles. Really neat how that works. So back to the slides. So usually it takes, the biggest changes will happen in the first Trigenics maneuver. In the first Trigenic session, we may need to work on 1, 2, and commonly 3 different areas. It typically takes 5 to 10 minutes once we diagnose and determine that we can help you out. It's going to be an on-the-spot, oh my gosh, my knee feels so much better. In the testimonials that you'll see in just a second, we actually will show you people before with their arms out. They squat as low as they can before. You see their faces like, ouch. And then 5-10 minutes later, after doing the Trigenic session, we have them squat. We see how low they go, and I usually ask, hey, how'd you feel after that? So when you see the testimonial videos coming after this, you'll know that I did the Trigenics maneuvers. Right after that, we went ahead and videoed an after. So definitely make sure you check that out. Those will be attached at the end of this. In order to rehab muscles that have been so tight, some of them so contracted for so long, there's scar tissue in there, they're used to being shortened, they're weakened, so Trigenics will help to re-educate those nerves and those muscles so we strengthen and lengthen. But we're going to need to get some rehabilitation therapy. So there's certain exercises that would be done, that would be highly recommended and included in the plan that can be done at home. We give you those exercises, but then we will also follow up, if needed, in most cases do need, some sort of therapy, and the best therapy I found is cold laser therapy. Why? Well, it reduces inflammation, and that's the definition of arthritis, is joint inflammation. Cold laser has been proven to speed healing, and that's a good thing. Reduces pain, and it's also painless, so I thought I would mention that as well. It's cold laser, so we're not frying any of your tissues. It just helps to speed the healing. So, as I said, I will talk about the testimonials. I'll go ahead and post those at the end of this. Super fast results, like I said, 85 to 90% of the time. Should you decide to come in for the initial examination evaluation, I will usually do an exam, see if you're a good candidate. I may even do just a quick Trigenics maneuver to see how your body responds. We may need to take x-rays. On the follow-up visit, I'll let you know whether I think you're a great candidate for the program or not. We'll go over the x-rays, talk to you about those, and then we'll get started. And if you're a great candidate, in the first, second, sometimes the third, I mean, it's just like that. It's just an on and off switch. Bam, the thing is working so much better. And I certainly hope to be able to include you in these testimonials. Typically with Trigenics and knee, it is a permanent solution. Unless there's some sort of new injury, it's usually a permanent solution. So, frequently asked questions, I figured I would bring these up in advance. So this program sounds really good. I'd like to be one of your testimonial cases as well. How much does it cost? Truth is, I hate to say this, but I don't know. Certain cases need one Trigenic session and you're done. Don't need any laser. That would be more of a recent injury. Example, my daughter hurt herself. It was falling off a horse. She's 12 years old. That's going to be a fast recovery. It was a knee tweak. I did one Trigenics maneuver. I don't think we needed to do any cold lasers at all. That's going to be pretty inexpensive doing something like that. I had on the other side of things, I had a gentleman who had an injury that goes back 30 years. Bone on bone is what the x-ray showed. Both knees, very complex case, extremely tender knee, so I really couldn't get in there as much as I needed to. So we knew we would need more time on that. On a session like that, probably as many as 3 or 4 Trigenics maneuvers. Probably in his case, we recommended upwards of 24 follow-up laser therapies. We have certain cases that may need other things like knee decompression that helps to decompress that bone on bone. That's a traction maneuver that we can do. In addition to the laser, the decompression, there may be some supplements that might be needed. So it just really depends on what, how old you are, how long the problem's been in there, what sort of complexities we have. So I'm sorry I can't give you an answer on that, but I would invite you to come in for the exam, take the x-rays if needed. On visit 2, I'll go over exactly how much it's going to cost and how complex the case is. Hope that's fair enough. Frequently asked question number 2, will my insurance cover this program? Probably not. Amazingly enough, they'll cover drug therapy. They would cover chiropractic therapy. Chances are, if you're a patient of mine, we've already tried chiropractic adjustments. Many insurances will cover that, so that would be something to try first. If an adjustment handles it, wonderful. We don't need to go with Trigenics. But Trigenics is not going to be covered by insurance. Laser is not going to be covered by insurance. Some might cover the decompression. It may cover that, but it won't cover any supplements needed. So the answer to that is probably not, but it might cover some. But we'll definitely let you know on visit 2. Okay. Frequently asked question number 3: Typically after a seminar, and I know we're not talking live with you here, but usually after a seminar, people will come up, well, I have this and I have that and I fell off, and then I'm not sure, what about my knee and I have diabetes, can you help out? And I got bone on bone, but the doctor said I need surgery. It's impossible in this scenario to answer whether I can help you individually or not. So once again, we really need to do an examination. Let me do an exam. I'm going to make a great offer at the end of this. Hopefully you take me up on the offer. I'll do a detailed, thorough examination. The point being, do I really think I can help you out? And if so, how much is it going to cost? We'll cover that on visit 2 also. Well, action steps. So at this point, we would need you to set an appointment for the exam and x-rays. I'd ask you to bring a t-shirt and definitely shorts. We definitely need to have shorts if we're doing the knee. On visit 2, we'll provide recommendations, so we'll definitely give those to you. And normally all of that is $150.